Chapter 15, Treatment of Diseases of the Eye. Let's skip past the key terms as we will go through them in the chapter. However, I do have peripheral vision highlighted, sometimes called side vision. This is usually the first area of vision to be lost with glaucoma. Dry eye occurs when the eyes do not produce tears properly or when tears are not of the correct consistency and evaporate too quickly. Inflammation of the surface of the eye may occur along with dry eye, and if left untreated, this condition can lead to pain, ulcers, or scars on the cornea and some loss of vision. Permanent loss of vision from dry eye is uncommon. Dry eye disease is treated with prescription and over-the-counter OTC eye drops, Restasis, Cidra, are prescription ophthalmics that treat moderate to severe dry eye disease. OTC lubricating eye drops also provide relief of mild symptoms, and those are just like your natural tears, TheraTears, whatever store brand of artificial tears there may be. And this chart just lists the percentages. The cyclosporine is an emulsion and it's 0.05%. The Cidra is a solution and it is 5%. A sty is a small painful lump located on the eyelid margin. So you can see in this photo here, figure 15.1, that white piece on the eyelid is a sty. It is caused by an acute self-limiting affection of the oil glands and the eyelid and typically resolves on its own in a few days. When more than one sty is present at the same time, the condition is called blepharitis. Blepharitis is also known as granulated eyelids because of the distinctive flaky scales that are found on the eyelids and eyelashes that are produced by this condition. So figure 15.2 shows that there are two forms of blepharitis, anterior and posterior. Anterior affects the outside of the eyelid where the eyelashes are attached, and it is caused by bacteria and dandruff. So you can see that on the eyelids here. Posterior blepharitis affects the inside of the eyelid and is caused by dysfunction of the oil glands in the eyelid, psoriasis, and acne. The symptoms of blepharitis are eye pain or burning, excessive tearing, feeling of something in the eye, light sensitivity, blurred vision, dry eye, and flaky scales on the eyelids and eyelashes. Blepharitis is self-treated by applying clean, warm compresses to the eyelids to loosen the scales, followed by cleansing the eyelids with a mild eyelid scrub. Anti-infective ointments, corticosteroid eye drops, and artificial tears may also be used to manage the symptoms of blepharitis. Aminoglycoside anti-infectives are used in the treatment of blepharitis, and those include gentamicin, neomycin, and tobramycin. Conjunctivitis, which is sometimes referred to as pink eye, is a common ailment that causes itching, burning, and teary outflow and can be caused by allergies, bacteria, or a virus. Viral and allergic conjunctivitis is typically self-limiting and resolves within treatment and anti-affective agents. Conjunctivitis of bacterial origin is contagious and is treated with antibiotic eye drops or orally administered anti-infectives. Conjunctivitis in newborns may be caused by exposure to a sexually transmitted infection and is treated preventively by administering antibiotic drops at birth. Antibacterial agents that are used in treatment include aminoglycosides, sulfonamines, quinolones, and macrolides. The antiviral trifluridine is used to treat keratoconjunctivitis caused by herpes simplex type 1 virus. Iritis is a condition associated with inflammation of the iris, Most causes of iritis are unknown. Known causes can be herpes, virus, autoimmune disease, eye trauma, infectious diseases, and juvenile rheumatoid arthritis. Symptoms of iritis include redness, blurred vision, inflammation, pain, and light sensitivity. It is treated with the administration of corticosteroids to reduce inflammation and mydriatics to reduce painful swelling. Mydriatics act on the dilator muscle and atrials of the conjunctiva to produce vasoconstriction and dilation of the pupil. Antivirals are administered when iritis is caused by a viral infection. Keratitis is a severe infection of the cornea and may be caused by bacteria or fungi. If untreated, the infection can cause permanent loss of vision. The most common cause of microbial keratitis and fungal keratitis are trauma, immunodeficiency, and chronic eye surface disease. Contact lens use can also cause microbial and fungal keratitis. So uveitis is treated with the administration of corticosteroids to reduce inflammation, mydriatics to reduce painful swelling, and anti-infectives, antivirals, or antifungals as appropriate. Most drugs used to treat eye infections are applied topically. Humira does treat uveitis. It is an injectable drug. Topical agents used in the treatment of eye infections are listed in the drug tables in this chapter. So in this table here, we have topical ophthalmics used to treat bacterial infections. So gentamicin comes in a solution. Tobramycin comes in an ointment and a solution. Neosporin, which is the eye neosporin, neomycin sulfate, bacitracin, zinc, and polymyxin B sulfate comes in an ointment and a solution with a little bit different ingredients. It has the medicine in it. For the sulfonamides, we have sulfacetamide, which comes in an ointment in a solution. You can see the brand name is Blef 10. So blepharitis, Blef. Polytrim, very popular, comes in an eye drop. The quinolones, we have quite a few eye drops in this class. Besavans, which is a little bit newer, is bezafloxacin. You can see all of these have that common ending of floxacin, as do quinolones. Ciprofloxacin is available as a solution in an ointment. Same with Zymar or Zymaxid. Levofloxacin, moxifloxacin are available in solution. Same with ofloxacin. Macrolides, we have azithromycin, the eye drop, which is azosite. So this is the same medication that's in a Z-Pack, but it's just formulated for the eye in an eye drop. Erythromycin, we have an ointment. Then in this category, we have the anti-infectives plus corticosteroids in them. So this first one has neomycin, bacitracin, and polymyxin B, but it also has hydrocortisone. So it's a little different from the one that we just talked about. And all of these are combination drugs, gentamicin and prednisolone, sulfacetamide and prednisolone, tobramycin and dexamethasone, Tobradex. That is a very common medication prescribed. It is an ointment and a suspension. Cytomegalovirus retinitis is an opportunistic infection in the eye that occurs in patients who have HIV infection, AIDS, or take immunosuppressive drugs. The most common symptoms of CMV retinitis are decreased vision, eye pain, floaters, and photopsia. If untreated, it can lead to blindness. Vitreous floaters are particles that cast shadows on the retina and appear as spots, cobwebs, or spiders. Photopsia is a condition similar to floaters and is associated with flashes of light. Cytomegalovirus retinitis is treated by administration of antivirals such as ganciclovir, valganciclovir, foscarnet, and cidofovir. The The herpes virus is the cause of more than 500,000 cases of blindness annually. The two strains of the virus that can cause eye infections are herpes zoster and herpes simplex keratitis. Other common viral infections caused by the herpes virus are chickenpox and shingles, and cold sores on the lips and mouth, which is herpes simplex 1. Viral infections of the eye are treated with antivirals. They may be administered topically in the eye by mouth or IV infusion, according to the drug and condition being treated. Corticosteroids may also be prescribed to reduce inflammation of the trabecular meshwork. Inflammation can impede the outflow of eye fluids and lead to increased intraocular pressure and pain. The use of corticosteroids must be carefully monitored because the drugs sometimes increase IOP. Mydriatics may be administered to maintain the normal flow of eye fluids and prevent buildup of IOP. So in this chart, we have drugs used to treat viral infections of the eye, which we've kind of talked about some of these already. But we have a couple that, for instance, the oral tablet Valsite. So there's no other oral tablets that can be used. So that one's kind of interesting. Cytovine comes in a gel and a powder for injection. So that one can be injected. Same with Foscavir and Cytofovir. Fusarium keratitis is a rare fungal infection of the eye that occasionally occurs in people who wear soft contact lenses. If not treated, it can lead to blindness, and one of the medications we use for treatment is natamycin, ophthalmic suspension. Ocular toxoplasmosis is caused by protozoa. It can be transmitted by handling cat feces or eating raw or undercooked meat or handling it. According to the CDC, there's apparently 1.26 million people in the United States that have this. Exposure to the protozoa causes development of antigens that can cause ocular inflammation, vasculitis, uveitis, and retinal edema. Helminthes are parasitic worms that can cause eye infections and blindness. 3 species can cause infection in the human eye. Onchocerca volvulus is a round worm that causes onchocerciasis. Onchocerciasis is also known as river blindness and is the second leading cause of infectious blindness in the world. Tanium solium is a flatworm that causes cysticercosis, an infection caused by eating undercooked pork. Toxocarisis is the 5th leading cause of uveitis worldwide. Ivermectin kills the living worms that cause onchocerciasis infections and prevents inflammation and scarring. A single dose of ivermectin is administered yearly. Cysticercosis and toxocarisis are treated by the administration of topical corticosteroids and systemic anthelmintics such as albendazole and thiabendazole. Surgical removal of the living worms may be necessary to reduce damage to the eye that might occur when drug therapy is used. So just a tech note that I want you to remember, ophthalmic drugs can be used in the ear, but otic drugs cannot be used in the eye. So if we need to treat something that is available in an eye drop, we can put it in the ear, but we cannot put eardrops in the eye. So here's the summary of treatments of bacterial, fungal, and viral infections of the eye. So we have the usual dosages on here. So for instance, the tobramycin, they are gonna apply usually 1 to 2 drops, or sorry, instill 1 to 2 drops in eyes every 4 hours. Or if they use the ointment, they're gonna apply the ointment 2 to 3 times a day or every 3 to 4 hours, depending on what the infection or how severe the infection is. So we have all of that. You'll notice that in some of these, it says apply 1/2 inch ribbon. So for that, we in the directions, we would put that because the doctor should have explained what they mean by that to the patient. If not, then the pharmacist can definitely point the patient in the right direction with just making a ribbon of it on your eye. It is estimated that more than 70 million people in this world have glaucoma. It is now the second leading cause of blindness worldwide. There are several types of glaucoma, and all are associated with progressive damage to the structures in the eye responsible for vision. Peripheral vision is the first to be lost. The person gradually loses the ability to see images from the sides, tops, or bottoms of the eye. Eventually, only the central vision remains. Open angle glaucoma is the most common and results from abnormal accumulation of aqueous humor. This in turn causes excessive intraocular pressure, which we abbreviate as IOP, that produces degeneration of the optic nerve. Sometimes damage to the optic nerve can occur in the absence of increased IOP. When this happens, low tension or normal tension glaucoma is said to be the cause. The unit of measure for IOP is milliliters of mercury, which you'll see as mmHg. IOP rises rapidly to dangerously high levels when a person has narrow angle or angle closure glaucoma. Normally, aqueous fluids can drain from the eye through an opening where the cornea and iris meet. This region is called the angle. When the angle becomes obstructed, as occurs with inflammation or partial blockage of the trabecular meshwork, aqueous humor drainage is impaired and there's a sudden increase in eye pressure. Drugs used in the treatment of glaucoma can be divided into two main classes according to their method of action. Drugs that lower IOP by decreasing the formation of fluids that build up in the eye, or they promote drainage of fluids that accumulate. More than a single agent may be administered for the treatment of glaucoma. When 2 drops are administered, the second drop should be placed in the eye at least 5 minutes after the first agent. This will give the first eye drop time to soak in and avoid being washed away by the second drop. So that's something a patient might ask if they have to use more than one eye drop. So LOL is a common ending for beta adrenergic antagonists, also known as beta blockers. So we have beta blockers that are eye drops. We also have oral beta blockers that are given for hypertension and other heart related conditions. Most drugs used to treat open angle glaucoma are beta adrenergic antagonists, also called beta blockers. They are also administered for the treatment of intraocular hypertension. Stimulation of beta adrenergic receptors on ciliary cells increases secretion of aqueous humor. Beta adrenergic antagonists decrease aqueous humor formation by inhibiting the action of epinephrine and norepinephrine on beta adrenergic receptors located on the muscle and on blood vessels within the ciliary body. However, betaxolol is the only beta adrenergic antagonist that is selective for beta 1 receptor sites. This means it's safer to use in patients who have asthma, congestive heart failure, or other conditions in which blockade of beta 2 receptor sites are undesirable. So we have a table with the beta adrenergic antagonists and their dosage forms and strengths. You can see all of them have that LOL ending. And then there's a combination with timolol, and brimodidine. And another tech note, to minimize systemic side effects, patients are advised to gently apply pressure to the lacrimal sac for 1 to 2 minutes after the administration of eye drops. Alpha adrenergic receptor agonists are used for the prevention and treatment of increased IOP. There are two alpha adrenergic receptors in the eye, alpha 1 and alpha 2. Administration of alpha 1 adrenergic receptor agonist reduces blood flow in the ciliary body, and administration of alpha 2 adrenergic receptor agonist reduces the formation of aqueous humor. So we have the two alpha adrenergic agonist, Alphagen, Lumify, Mervaso, and Culania. Those are all brand names for the brimodidine. And then we have iopidine, which is the brand name for aproclonidine. So generic brimodidine 0.2% is not substitutable for alphagen P, which is currently only available in 0.1 and 0.15 strengths. Carbonic anhydrase inhibitors are indicated for the treatment of open-angle glaucoma. Acetazolamide and methazolamide tablets are also indicated for prevention of secondary acute angle closure glaucoma, short treatment of angle closure glaucoma when surgery must be delayed, reduction of IOP after cataract surgery, edema, and prevention of altitude sickness. Carbonic anhydrase inhibitors inhibit the enzyme carbonic anhydrase. The enzyme is involved in the process of converting carbon dioxide water to bicarbonate. Zolamide is the common ending for carbonic anhydrase inhibitors. So we have acetazolamide, which is under the brand name of Diamox. It comes in a capsule. It comes in a powder for IV use, and it comes in tablets. Brinzolamide is only available in an ophthalmic suspension. Dorazolamide is only available in an ophthalmic solution, and methazolamide is available in an oral tablet only. And then down here we have all of the different combination medications. And it is common that people who have had allergic reactions to sulfonamide anti-infective agents might also have allergic reactions with carbonic anhydrase inhibitors. Miotics are drugs that promote drainage of the aqueous humor. They produce this effect via a variety of mechanisms of action. Cholinergic agonists, acetylcholinesterase inhibitors, and prostaglandin analogs all promote damage of accumulated levels of aqueous humor and reduce IOP. Cholinergic agonists like pilocarpine, carbachol, and ecothiopate are used to reduce IOP caused by glaucoma and cataract surgery. Cholinergic agonists bind to receptor sites and produce effects that mimic the neurotransmitter acetylcholine. Binding produces parasympathetic nervous systems effects in the eye, such as contraction of ciliary muscles, and results in miosis. Pilocarpine is a cholinergic agonist that is used in the treatment of open and closed angle glaucoma. Cholinergic agonists also produce dilation of the trabecular meshwork to decrease IOP. Pilocarpine is also used to treat dry mouth, which is xerostomia. Ecothiopate iodine is a cholinesterase inhibitor. Cholinesterase inhibitors block the enzyme that deactivates acetylcholine. And these are the directions for preparing those ecothiopate iodine eye drops. A septic technique must be used. You're going to tear off the aluminum seals, remove the discard rubber plugs from both the drug and the diluent containers. Pour the diluent into the drug container. Remove the dropper assembly from its sterile wrapping, holding the door assembly by the screw cap and without compressing the rubber bulb. Insert it into the drug container and screw down tightly. Shake for several seconds to ensure mixing. So we have our cholinergic agonists, carbachol and pilocarpine, which are both available only as ophthalmic solutions. And the phospholine iodide, which is the cholinesterase inhibitor, ecothiopate iodine, is made for a powder for reconstitution. Vimetipros, latanoprost, and travoprost are prostaglandin analogs that are prodrugs. They mimic the action of prostaglandin F2A and relax the ciliary muscles to permit drainage of aqueous humor. Prostaglandin analogs directly dilate the trabecular meshwork to promote drainage. The use of prostaglandin analogs can cause changes in the color of pigmentation of the eyes and can also thicken eyelashes. Latisse is marked as a topical solution to increase the growth of eyelashes in patients that have hypotrichosis, a condition where they have no eyelashes. And PROS is the common ending for drugs that are prostaglandin analogs. So all of those are available in a ophthalmic solution. And then we have the combination drugs with the prostaglandin analogs and the beta blocker timolol in a dual eye drop. All right, now we have the summary of drugs used to treat glaucoma, and we have our generic brands, our usual dosage, which we kind of already seen for some of these in the previous tables, but this one does have warnings. So the use of marijuana is controversial. Although smoking marijuana has been shown to reduce IOP, it is an illicit substance in the United States according to federal legislation. Possession is a federal crime despite passage of regulation authorizing medical use in some states. So although in Michigan, I know some of the other states might not be medically or recreationally statewide approved for marijuana use. But in Michigan, we are both, but that doesn't mean that it's legal federally. So we can't just be like, oh, go get some, marijuana and your glaucoma IOP will be reduced. We can't really do that yet. So the beta adrenergic antagonists, some of the warning labels say that we should shake well for betaxolol suspension. So any eye drop that's a suspension, meaning the medication is not mixed thoroughly until shaken, we need to shake well. The solutions we don't need to, but for the suspensions we do. And you should wash your hands before you use eye drops to avoid contamination of the tip for all eye drops. You should never touch the tip. Remove contact lenses before use. Wait at least 15 minutes before reinserting. And do not discontinue without medical supervision. For the alpha adrenergic agonists, store at room temperature, protect from light, wash hands before use, remove contact lenses before use, and do not discontinue without medical supervision. For the carbonic anhydrase inhibitors, remember we have an oral capsule, so that should be taken with food and should be swallowed whole. It can cause dizziness or drowsiness. And the other warnings are the same as the above. Same with cholinergic agonist. Do not wear contact lenses with the carbachol. And for the prostaglandin analogs, the latanoprost and latanoprost plus timolol should be refrigerated and not froze. And lastly, laser surgery can be performed to reduce IOP. There are three forms of